Ladies and gentlemen, please welcome to the stage Foreign Policy's publisher and CEO, Andrew Solinger.
Early-ish. That means you're very eager and interested in a fantastic program that we have this morning. We're so happy to have you join us here at Risk, Resilience, and Results. We're going to talk about the importance of investing in locally led climate and health solutions. It is early and there's traffic and all that sort of thing, so the program is shifting a little bit, so bear with us. We've moved a few things around. We still have a great program. We're just shifting a few things around. But to set the stage, climate change continues, of course, to intensify global health crises, resulting in malnutrition, vector-borne diseases, and health-related illnesses, and this disproportionately impacts the global south. So we really want to talk through how we can help vulnerable communities. So health adaptation is key to climate resistance. We're going to cover that, and we're going to focus on global community-led efforts at the grassroots. That's how this can change and how we can strengthen global health systems. So this event marks the launch of a special report developed by Collective Minds Climate and Health Council, with support from Foundation S and the Africa-Europe Foundation, our friends at both. It's titled Risk, Resilience, and Results, and you have a copy fresh off the presses, you should, on your chairs. I'm not sure that I see them around, but we'll be able to hand those out. Do we have copies? No, we have copies of FP Magazine. Oh, they're over on the table. Okay, so there will be copies available for you, but I know they're freshly out. Please do check them out. Lead researcher of the report, Kevin Lin, is excited to be on stage later and moderate a conversation in a moment that digs into the report in more depth and share some of those findings. He will be your AI summary for that report. Today's conversations, we have global leaders from the local to global level to spotlight concrete examples, and we're excited to bring them to you. A couple of more housekeeping things. there is a card on your chair that has a few QR codes on them. If you scan that QR code, you will go to the agenda. You will see the speakers and their biographies trying to save the planet and paper at the same time. On the flip side is a QR code where you can subscribe to Foreign Policy Magazine. If you're not already a subscriber, please do subscribe. The print magazine, we still do quarterly print magazines, our heritage, but we're mostly a digital news organization, and there's a lot of fantastic coverage of obviously health and climate, geopolitics writ large, and especially coverage of what's going on at UNGA. In fact, we publish a special daily edition of our SITREP newsletter, which has come out the past couple of days. We'll do one today. Please do sign up for that. You can find that on our website, and that's free. You could absolutely sign up for that. Let's see. Finally, I want to, and very importantly, thank our partners. This would not be possible without the help of the Africa-Europe Foundation and Foundation S. This is a multi-year program we've been doing. It's been a very successful way to kick off our massive health program day that we're having today here in this space. So without further ado, let's get cracking and hear from our partners.
Please welcome to the stage Foundation S Acting Interim Executive Director and Sanofi Global Head of Corporate Social Responsibility and Sustainability, Sandrine Boutier-Streff.
Good morning, everyone. Honorable ministers, distinguished guests, ladies and gentlemen, I'm very honored to welcome you this morning on this important event. And so thank you for joining us, both in the room and also in distance. So clearly, if you are here, that means that it's a recognition of we share a commitment in order to tackling one of the most urgent challenges in our time. So we are facing a convergence of crises. First, the decrease of funding for global health. Second, the rise of inequities in the world. And third, the climate change. In the global south, floods, droughts, or outbreak are harmful for the population and threaten communities and lives of population. And yet, the scale of devastation is going far beyond the resource and the solutions currently available. Today, we are pleased that Foundation S, the philanthropic entity of Sanofi, and our council, Climate Council, Collective Minds, we are proud to launch our report, Risk, Resilience, Results, the power of investing in local-led climate and health solutions. So the report is amplifying the voice of communities who are not waiting for change. They are driving their own changes. From Africa to South Asia, we see a local leadership, knowledge, and innovation to deliver innovative and real solutions on the field. And they are calling on the global community to stand with them. Despite the promise of giving funding, 0.5% of multilateral climate funding goes only to climate and health, and just 5% to adaptation. We must do better. The report is offering a lot of recommendations that are activated already in the field to shift the paradigm toward community-led solutions, scalable solutions that protect health and build resilience of the population. You are here because you believe in change. Together, let's advocate for smarter investments and stronger partnerships to put community at the center of the solution. Thank you very much for being there. I hope that we will together change or contribute to change the world, and particularly to support the communities that are waiting for us to lead by themselves. So thank you, and I hand over to the moderator. Thank you very much.
Please welcome Mayor of Freetown, Sierra Leone, Yvonne Akisoya, former Senegalese Minister of Health Professor Ava Marie Kolsak, Global Climate and Health Alliance Vice Chair, Dr. Omnia El Omrani, and AMREF Health Africa Group CEO, Dr. Githinji Gitahi, for a conversation with Collective Minds Report lead researcher, Kevin Lin.
Good morning, everyone. Good morning, and greetings to those online. I want to start today by reflecting on the report that was just released today, Risk, Resilience, and Results, which sought to uncover local solutions to the impacts of climate change on health as told by communities in Africa and South Asia. What we found in developing the report were solutions as intended, but in actuality, we found so much more. We found stories of deep change, stories of unwavering hope, and stories of incredible leadership. For me, it was a real honor to have the opportunity to listen and gather these stories. And I want to take the opportunity now to thank those communities for entrusting me with their wisdom to share with all of you. So in saying that, I hope you do get the chance to read the report and learn from the communities. If you do, you will learn that communities are deep resources of ingenuity when it comes to developing solutions that we found to be diverse, comprehensive in approach, and efficient in the use of resources. So today's panel is all about community action, and how best to support communities. And I want to start with Dr. Amrani and work our way up to Professor Kolsek. Dr. Al-Amrani, you are Vice Chair of the Alliance, and you have mobilized thousands of individuals in climate change and health work globally. To start us off, what do we mean by communities leading solutions?
Yeah, first of all, thank you so much for having me, and it's such a privilege to start the day together and focusing on communities. In terms of communities leading solutions, there are three key aspects of what that means. The first one is communities as co-designers, as custodians, as the ones who understand the local realities and can identify the most urgent needs, not only to climate change, but also to all the challenges that is affecting them in terms of health, well-being, socioeconomic, and that. And at the same time, looking at their agency and their ability to, and for us to have these partnerships to create a sense of co-creation, but also adaptive learning. And I've had the opportunity to work with different communities and understanding how starting with one approach with one community, while working with them, they can completely need something else. One example of that, there's an organization that is based in Nigeria, and one of the civil society organizations supporting them wanted to help them reduce deforestation. The initial approach was to do capacity building and see how can they help communities understand the impact of deforestation on spillover and infectious diseases, but also environmental degradation and the health implications of that. But then they actually realized what they need, and the reason why they are doing deforestation is that they need the wood fire for cooking and for basic needs in the household. So the approach completely changed. Instead of doing capacity building, this organization decided to provide energy-saving stoves, to provide new ways of, for example, using briquettes and other better sources of energy, and that would help reduce deforestation. Another example is the organization Health in Harmony, where they were able to address deforestation with communities by actually focusing on providing them with access to healthcare services, because this is why they are doing the logging and the deforestation, to be able to afford medical care, but they are able to build healthcare facilities and primary health centers in the most remote and indigenous communities in cooperation with them. And that really helped them drastically, with many data proving how deforestation has decreased exponentially because of the intervention. And that's the key part of adaptive learning, of having these partnerships, but also believing in the agencies of communities, that they understand what they need, and we are there to work together to address that.
Thank you. Mayor Aki Sawyer, in addition to being mayor of Freetown, you are the co-chair of C40, a group of nearly 100 mayors committed to addressing climate change. So you are helping lead local solutions at home, but as well as around the world. My question for you is, how can local actors best be supported to lead change?
Thank you very much, and good morning, everyone. I think the example that the doctor just gave of adaptive learning, seeing a community working from the ground up, is precisely what we're able to do as local government. So you've come at it from the perspective of a not-for-profit and non-governmental organization, but when the municipality takes the lead, you're able to do this at scale. So taking the example that you've just given, and the question you've asked is, you know, how are local governments able to, how are local municipalities able to lead on this, able to support this? Freetown the Tree Town is our city's initiative to plant 1 million trees in order to reduce floods, reduce landslides, provide income, provide jobs, and it's community driven. So we're doing it at scale because as a local government, we have that greater reach and we have that greater access. So we're able to take the views of communities and amplify them. This was community-led, community-organized. Every single one of those trees, we're now at 1.2 million, is planted within community. And it's the community youth particularly, but also women, who are planters, who are monitors. So each tree is individually tagged with a unique identifying number. It's uploaded onto a digital platform, and the payment to the young people who are the growers and the trackers is based on the growth of the trees. So we've created over almost 3,000 jobs from this, but we've also created livelihood opportunities because 60% of the trees are economic trees. And at the community level, it's really changed the dynamics. I can think back very vividly to a visit to one of these sites, a visit of a site which had been affected by the mudslide of Freetown that some of you may have been aware of. 14th of August 2017, 1,000 plus people died in that, on that fateful day in three minutes. We planted one of the communities where they were at the bottom, the end of the mudslide. And I remember, I always remember this, an elderly woman saying to me, "We are not among the youth who are the planters or the growers, but we're the grandmothers who are going to make sure these trees don't get cut down." So that community, that sense of community is fundamental for there to be ownership, and the local governments have a big role to play in being able to ensure scale, amplification. And just very quickly, I'm sure I'm running out of time, but I just want to pick up on the point you made about alternative fuel. So a big driver of deforestation is the use of fuel. In my city, 82% of our cooking fuel is wood or wood-based, and that's the data we have. And one of the other reasons why empowering local governments to take these positions is because we're better able to align multiple streams of work. So we introduced under my administration in 2019, believe it or not, it sounds crazy, but it's true. For the first time ever, we built a wastewater treatment plant. There hadn't been one in Freetown. So, but doing it using very simple technology, and then thinking beyond that original purpose, and this is the intersection between health and climate change. Health was necessary because fecal sludge is not something you want to have all over your environment. So having the treatment plant was great, but the next step then was being able to use that fecal sludge to create briquettes. So we now have an alternative cooking fuel because we're using the sludge to make briquettes. We have financial challenges, which has meant it's taken us a year, but by the end of October, we will have a machine in situ, which will enable us to increase the production of that briquette to commercial levels, entering the market and replacing charcoal with a sustainable, renewable energy.
Amazing. That's incredible. And you mentioned youth, and that's something we saw in the development of the report as well, and that intergenerational support to enable local actors. Dr. Katahi, as CEO of AMREF, your organization has achieved great success across Africa in addressing the health impacts of climate change, from supporting the building of resilience of local health systems to facilitating the adoption of a common African position on climate change. My question for you is, how does AMREF work with communities to achieve these results?
Thank you very much. And first, I would like to say I'm a very happy minority on this panel. This is a really fantastic panel. So I'm happy to be the happy minority because we are always struggling with getting balanced panels. We had one yesterday where my friend C had to jump off the stage because there was no woman at all. It was just a man. So we're really happy to be a happy minority here. The climate crisis is a health crisis. And health is the most fundamental human right of all, because health is the foundation for education and the foundation for production, because we say healthy children learn and healthy adults earn. So if you want to build human capital, you must build it on a healthy population. Indeed, we know those countries that have done this. Most of them started during crisis, where they have actually invested in health. The UK started ahead of the First World War, where they were saying you cannot win a war with second-hand citizens, what they were calling Class C citizens. Because you want to win a war, you need strong people. That's why it started off with the army and stuff like that. So the health of the people is the foundation of prosperity. That, as AMREF Health Africa, is our mission, is our belief. So we believe in creating lasting health change. But then out of that, we also believe that health is not health care. That health is actually founded in the household where people live, learn, work, and play. And 80 to 90% of people are born healthy. And therefore, the role of our organization, working with governments and other partners, is to ensure that those communities remain healthy. And when they go into disease, we then provide a primary healthcare system which has primary care, has community empowerment, so that communities know exactly what they need and when, and has a multi-sectoral approach that makes sure that everyone is working together, not only in the health sector, but they're working together in leadership. And I'm really proud to meet a female mayor from Freetown who's been there since 2018. That means she's actually been doing extremely well. So I'm very proud of you, Yvonne, to have so using this concept that health is actually at home, then there is no other way to address a health crisis than to address it at home. Because that's really where the health is. That's the foundation of health. The health facilities, the hospitals, as we say jokingly, they are garages for repair when things go wrong. But primary care is first and foremost at home. And I hope that even as we build our health system, we keep that in mind, that it is at the most foundational level. Now, what we have done, therefore, is we have worked for 68 years in Africa, working largely on malaria and other infectious diseases, more recently non-communicable, maternal and child health. And over time, we've seen that the climate crisis has started to be the biggest risk to the primary healthcare systems that we've been building. And this biggest risk, therefore, means that we have to respond to it. And when we respond to it at community level, which is what we know best, because that's where health is based. So what we've done over time is to say, okay, we are seeing, and that data is telling us, that the risk to the communities on infectious diseases and non-communicable diseases is rising. We are seeing that malaria is rising in areas where malaria was not. There are studies showing in some communities it's gone up 20%. In several years because of the warming and going highlands and outwards from the equator. We know, for example, that countries that have had cholera under control have had significant outbreaks of cholera. Malawi, Zambia, because of climate events, extreme events. And these extreme events, which are going to, being exaggerated, are saying that cholera, which we thought we were eliminating, is coming back. So we have to worry about the health system that we build at community level and how it can support communities to actually avoid this illness that's actually preventable. We have seen public health threats increasing. If you just look at Marburg alone, the hemorrhagic virus, we had a Marburg outbreaks, 2 of them in 2023, Burkina Faso and Tanzania, 2024, we had one in Rwanda. This is the most frequent Marburg outbreaks we've had since the 70s. And there is evidence that the movement of the bats, the fruit bats that carry the virus, is related to warming and also related to human and environmental conflict because of all the things that have been talked about. Therefore, we have to respond to this crisis at a community level, because I can tell you that any health crisis starts in a household, whether it's a pandemic, an outbreak, it starts at the community level. So what have we done? What we've done is to say, therefore, we need to create tools for the communities themselves. The first tool is to actually bring up the community voices. Let the communities themselves say what is going on. And the communities are not just those women and girls and children. They are also community leaders, municipal leaders, people actually in the front line, not in Geneva, in New York, in the front line of where the work is, because that's the community. The second thing, once you bring up their voices, the second thing is to say, let them lead in the solution making, as you say, because they then come up with the solutions that are most context specific to where they live. Because they don't wait for us. You know, when communities have a crisis, they don't wait for this meeting. There's no one waiting for this meeting, by the way, for them to know what to do tomorrow at the community level. Whatever challenges they're having today, if there's a child with malaria, they're dealing with it today. So what you've done is strengthen those community units by giving them the resources they need. I'll just give one example of what we've done with communities first. When the Marburg virus broke out, outbreak came in Tanzania, it is a community health worker, 22-year-old young woman in Tanzania, armed with a mobile phone, who we had trained with support of CDC, America CDC, US CDC. I hope we can still train more. Now, that community health worker with the mobile phone saw that in her community, someone got sick and they called a motorbike rider, take the person to hospital. Then the next day, the motorbike rider was called back to pick her brother. The next day, the motorbike rider was in the hospital. And she went on her phone at 3 a.m. And because we had trained them on event-based reporting, she went and said, I have seen something strange. She doesn't need to be a clinician. She said, there's something strange going on. She reported at 3 a.m. The next day, the Tanzania government deployed laboratory workers to the place in Kagera where this thing was happening. And that's how the Marburg outbreak was actually controlled. Fantastic. Because the community health worker had the tool to actually respond. So we must not respond up here. We respond where the activity is, and we must trust them. The next thing, so that I conclude, is that you must, after supporting this, you must support the enabling environment for the community workers to do this, because they can't do this without resources, which is why now what we've done is to recognize that if really we need adaptation, we need the communities to be at the center of it. They need resources, they need information, they need tools. But who is going to provide those at large scale, as the mayor said? It is by us going now above and saying to the global community, we must release resources for adaptation. So in doing so, we went round and we found the national determined contributions of countries had absolutely nothing on health. They were all, and if you go and read them, can you imagine a country that has less than 1 metric ton of carbon emissions, maybe 0.7 per capita, while the US has 14 metric tons per capita? The country that has 0.7 is being told to target itself to reduce the 0.7 to 0.5. What nonsense is that? Because they are not even at survival level energy. So we are now trying to say, let us focus some of these communities on adaptation, which means we must release money for adaptation, even as we advise them and we work on mitigation, which is a dual benefit, as you said. We must also try. So we have now developed the Africa Common Position so that governments can embed health adaptation in their national determined contribution, pushed hard to get the Declaration on Health, and finally now we have the language on health in the COP30 in Belém, Brazil. Yes. So that's what we are doing in the communities.
Fantastic, fantastic.
Thank you. And your comment on the importance of listening to community voice is a good transition into my next question for Professor Kolsak. So you've been Minister of Health of Senegal twice. You recently received the WHO Director General Award for Global Health in recognition of your lifetime achievements, and you support various global philanthropies. As a leader at the national and global levels, how can multilateral organizations, governments, and philanthropies elevate community voices to national and global discussions?
Thank you. I would like, first of all, to recognize what has been said already. And it is not because you have worked at national or global that you are not sensitive and you don't understand that community need to be at the center of everything we are doing. And it is why, before responding to your question, I would like to say that personally, I have been also involved in NGOs and working at community level. And I think that this has helped me a lot to be able to navigate at national and global level. And we cannot just decide that we have communities there and the global there. We need to have bridges between the global, the national, and the community. Knowing, as this has been said already, that everything, what we have climate impact or climate changes in countries, the community are the first to understand, to have floods, to have drought. They know that this is their problems. Sometime before the national level start to speak or do something. What we need to do, I think that at the multilateral communities have a lot of problems today for other things. But what we need to know is that they need to continue to play their role of coordination and conveying power. This is unique. And if we don't have it also, we cannot just let people work and do what they want. They need to, the voice of the community need to arrive there. And what is important is that this multilateral need to ensure that the community are there. And I am happy to see that my sister, young sister, and my daughter are at high level of a lot of organization and multilateral or others or philanthropics, because we need to have them there. We cannot discuss in Brussels, New York, as he said, or Paris or Geneva without them. And this is for me very important. This role of convener needs to be that they convene and they are able to speak for all the world, but by listening and acting and working with all the actors, and the actors as really the communities. Important also is to ensure that, for example, climate change is not a silo, health another one, and another one, agriculture. We need to work together. The concept of One Health, people often are saying that, but it is very important to ensure that, because at community level, you can have a problem of drought. She gave me the name yesterday, but I don't remember. I cannot pronounce it, but it is drought. I have seen it very well. I know that at community level, you can have a problem with that. You can have a problem of flood. You can have an issue of agriculture. And at the same time, malnutrition, and you are not healthy. So the people, one person can be affected by all. It is why we cannot also at global continue to give declaration and all these policy things, plans, when it is really not like this, the reality. The other thing is for the government. When you have participated, for example, to the COP, and hopefully we had one day for health, it was very important, COP28. But also, we have seen declarations and things like that. But at country level, you cannot come, do things at global, and come back to your country and sit and wait for I don't know what. You need to act. And the governments cannot sign declaration without having a plan to ensure that what they think and they trust that this is what to be done, need to be implemented. And link climate change to health is also to build structure who can really cope with climate change. You cannot have floods in your structures, health structure every year without thinking that you need to do something. You cannot also have know that we have a problem of climate change lead to energy and things like that without thinking to have solar power in your structure. The supply chain management, you need also to know that the people there need to have access to everything, to the drugs, because sometimes you have flood and nothing is going to the community. Last point for me in your question is what to do, what the foundations and philanthropics need to do. I think that they have a unique role. It's a role of catalytic. It is important for them to ensure that the communities are really supported, because often government and global, they have more technical or sometimes policymakers. Implementation is there, but the problem of scale.
Yes.
And often the philanthropists are helping countries on that. And I would like to thank really the Fondation S, because I have seen a lot of grants now going directly to the communities with a very flexible process. And this is important because they are more flexible and they can help the community to be able to adapt with all the change we have seen these years. Community needs to be at the center. They cannot be just look like a victim. They are the ones who are really changing things in the field, and we need to understand that they are the ones who will be able also to change things and adapt at the community level all what we are saying here. It is not us. Thank you.
Thank you. And I see we have only 2 minutes left, so this will be kind of our quick TikTok moment of maybe 20-second responses. But we do have an influential group of people in the audience and online. We have decision makers, donors, and local change makers. What steps or actions would you like to see them take to support communities in adapting to climate change and health? So again, just maybe a 20-minute, and we'll start here and work our way down. Or 20 seconds.
That's good.
Okay. I think fast showing up is important. So thank you for being here. Thank you for showing up, whether you're online or you're here in person. The next thing is to say we need to lift community voices. As you've heard, they are at the center. So policymakers must lift community voices, but not only by bringing them forth to these panels. The best way to lift community voices is to recognize and trust their knowledge, and you ensure that you provide tools for observatories, community observatories, where they can collect indigenous knowledge. We are doing that at AMREF, creating communities can come and say, my cow died, the river dried up, and this is what is going on. So trusting their knowledge is the best way of lifting community voices, so that decision-making considers their opinion. The next thing is to provide direct, flexible funding to communities. Direct, flexible funding. We're in the process of writing a grant to the Green Climate Fund. We hope, fingers crossed, that we go through the process and we actually win it. Yeah. Thank you. And that will be for enabling this community data integration and all that. So we hope it can come faster than several years because we don't have years to wait. The final point is to recognize that health is the face of the climate crisis. So we must have health in all climate policy. That's what we ask the decision makers to do. We have data through the IPCC. AMREF is involved in that data development for health in climate. Include health in all climate policy. Thank you.
Thank you. And maybe that's the best comment to end on. On behalf of the panelists, thank you very much for listening. And thank you to the panelists for your insights.
Next, please welcome the French Ambassador for Global Health, Anne-Claire Amprou, for a conversation with FP's Andrew Solinger.
That was a fascinating discussion, a hard act to follow. But I'm so pleased to be here with Ambassador Anne-Claire Amprou, the climate ambassador, health ambassador for France. Although we're talking climate and health, so I guess we merged the two together. That's a good Freudian slip for me to make. Thank you so much for joining, and would love to dig right in and talk a little bit about France's health strategy. How is France aligning its climate and health commitments against broader global climate goals?
Thank you very much. Good morning, everyone, and thank you for this event, very, very important event. And yes, I'm ambassador for global health, but actually it includes health and climate change. It's a very good example. Exactly. And actually that was the main objective of the French strategy for global health that we launched in 2023, so 2 years ago, actually. That was not the first strategy, but that was a new strategy, and taking into account the climate change with two aspects. The first one, or maybe three aspects. The first one is that when we talk about a strategy of global health, it's not a matter only of foreign affairs or health, it includes all the sectors. And the Minister, our colleague, mentioned it. It's a multi-sectorial approach that we need to have. So that's why, for example, the French strategy was launched by 3 ministers. That was the first time, actually. Foreign affairs, health, research and development, and the other ministries were involved, especially environment and agriculture. So that's the first point. The second point, what we wanted to do in this strategy and the ambition was to see the consequences of the climate change of health and global health on the health systems, but also the other aspects. The consequences of the health systems on climate change, especially when we talk about health system footprint. Mm-hmm. And we shouldn't forget that point because it's also very important, very challenging for countries. So it's exactly what we try to do. And one aspect that we included in the strategy is, of course, the One Health approach. Also because it's interministerial, but also to implement this approach and to explain concretely what does that mean. Is it just a costly approach or not? Is it a cost-effective approach or not? And to try to have this approach in the strategy. And as you know, this One Health approach has been integrated in the pandemic agreement, which was adopted at the World Health Assembly last May. So we were very, very proud of that, but it's not enough, I would say. Now we need to implement that with local solutions, and I know that Fondation S is working on it, and it's very important. And politically also, we need to continue to promote this approach, and that's why France will organize a One Health Summit in 2026 with head of states and governments, also to bring together decision makers, scientific stakeholders, to look at this approach, to have political engagements, and to implement this approach with local solutions everywhere.
That's interesting. When is that summit, that One Health Summit? Do we have a date?
Almost.
Okay. You'll keep us updated. Watch this space. We're all intrigued. So that was a very interesting approach and a multi-ministry a cooperative way to attack this problem, which I think is wonderful. I don't think I heard you say anything about the finance ministry being involved in that approach, though. So I'd like to move into financing and how we manage that. What kind of financing models are needed to unlock capital for locally led climate health solutions? And maybe you could tell us a little bit about why the finance ministry wasn't involved in those discussions, when that call happens.
Well, you know, at the end, the finance ministry is always involved.
Yeah.
And it was involved, actually, but not as the big minister supporting the strategy, because it is much more dedicated to other ministries. But it doesn't mean that it was not involved, because we need the finance ministry. Anyway, so this, of course, this question is very key. And especially in the current context, when we look at the global health architecture, the fragmentation, the funding fragmentation, how to address that? Well, first of all, with the French strategy, we try to have a double approach. First, through the bilateral funding approach and the multilateral funding approach. And according to us, it's complementary, especially to make sure that communities can have access to funding when it is useful, and it is always useful. Right. We know that. And the panel discussed that, and that was very, very important. So France contributes to global health initiatives, UNITAID, Global Fund, Gavi, Pandemic Fund. And they are key because through their programs, and of course, they have different programs, they can address this question. But it's not enough, and especially regarding this, the debate that we need to have about the global health architecture, and we need concrete example. Just one example is about UNITAID. UNITAID has developed a very specific strategy about climate change, as the mission of UNITAID is to make sure that the population have access to innovation and treatment. And you could see this morning the announcement that UNITAID managed to sign a contract with lenacapavir, which is very important to fight against HIV. So I would like to congratulate.
Those are very interesting agreements that were signed yesterday.
And it's a very good example of how to make sure that it is accessible for the population. But UNITAID also developed this strategy on climate and health. And the goal is to have climate smart product.
Right.
That means adapt to the local conditions, and when it is possible, locally developed. Adaptable to the changing needs of community affected by climate change. And we shouldn't forget that because of the climate change, the needs of the population might change. So we need to be to adapt the strategy. So it's a very interesting example. My last point is some of us were in Sevilla at the beginning of July. For the UN conference on development financing. And the French president...
It was very warm, I understand.
Oh, my God.
Reminding us of the importance of climate change.
Between 47 and 50 degrees. But that was a very good example. When we talk about climate and health, that was a very good example. And the French president was there, and especially for a very specific event on financing and the new tools and the new approach. We call 4P, the Pact for the Planet and People, which aims to have a new strategy when we talk about financing, domestic financing, but not only, with NBDs taking into account climate, health. And that was a very good example on how to work on finding new tools. That's not easy, but at least we need all the partners involved, and not only global health initiatives, but also multilateral development banks, countries with domestic financing, funding. That's very important. And it's a combination of that these tools that can make the difference.
Excellent. We're out of time, but I have to ask you about the pandemic treaty. Your co-chair, that was quite an effort. And one of the reasons that foreign policy is so involved in global health and it's critically important to our coverage, even though we're not health experts, we're geopolitical experts, but the policy and international cooperation especially following the pandemic, which was what brought us to this. Countries needing to band together to fight what was essentially an alien invasion that knew no borders, no politics, and wouldn't it be great for humanity to work as one mankind together to help each other? We didn't do so well. What have you learned from the pandemic treaty on how to get countries working together on the same page, and industry as well, by the way?
Yeah.
We only have 1 minute.
No,
so that's
1 minute. No, I can't do it in 1 minute. I will. No, it was a very big challenge and a great achievement for many reasons. First, despite the geopolitical context, also the lack of trust between member states after the COVID-19 pandemic. And of course, we had to take it into account. Member states, delegations in the room at 5 or 6 o'clock in the morning, they managed to reach a consensus on a very strategic issue and sometimes forget the national policy or context, the geopolitical context for one goal: health and global security. So that was key, and we need to learn from that. The job is not finished. Be careful. We need an annex to be adopted next year to have the pandemic agreement implemented. So we need to keep this political momentum. We managed to keep it. And I would like to thank delegations in the room. That was not an easy negotiation, as you know.
It's not.
But we managed to do that. We need to keep the political momentum to make sure that next year, here in New York, at the next INGA, we will be able to launch the ratification of the pandemic agreement.
We will have you back here next year, and we will
Of
have
course.
that discussion.
Of
And I
course.
hope it is successful, and I know it will be. Please join me in thanking the ambassador for making these wonderful comments and thoughts. Thank you. That was great. Thank you so much.
Please welcome to the stage Africa-Europe Foundation Deputy Executive Director, Holly Ranavazanani.
In the morning, really, and I hope that you're all like me, that you've been inspired of what you heard, of course, with all these great stories and the practical solutions that really hear and heard and been implemented in this climate and health space. So today, I think we haven't heard just about the impact that really has impacted our everyday lives. We heard about the flooding, the malaria, the heat waves, just Sevilla. We were in Sevilla, indeed, with the 54, actually not even 50 degrees Celsius. But alongside those risks, we also heard about the powerful stories around resilience, around these solutions that the communities actually are put into place by strengthening the local health systems, to the women associations, and of course the youth initiatives. But more importantly, we heard about the partnerships and also this catalytic financing that can help scale those solutions faster. So the message that we've heard the whole morning, and also that's the results of a year-long process that we have within this report, is that locally led action works. But for that to make it really being efficient, it needs to be trusted, represented, and financed differently. So if only a small share of global climate funding is reaching to community actors, then the system is not yet working for those who really carry actually the greatest burden, who are at the forefront of these innovative solutions. So this is why we at the Africa-Europe Foundation, together with Foundation S and of course the Climate Health Council that we co-founded, we speak from really moving from risk to resilience to results, to impact. So really from that fragmented efforts that we see to smarter partnerships. So what we heard today is not just a set of good stories. It's really a guide, a compass that we will need for the systemic change to actually happen. So as we look ahead, really we will continue to bring ahead voices, the priorities, not only, of course, at over multilateral events here at Yunga, but also COP30 or even the AU-EU Summit. It is our opportunity together, really, to place climate and health at the center of political agenda and to demonstrate that cooperation between our continents actually can be the model and also the level of ambition that the world needs. But we heard as well that multilateralism doesn't start in the negotiating room. It starts with communities, with these voices, these insights, and the action that shape the agenda. So let us leave today really with that clarity and determination. So we need to finance what matters. We need to focus, scale what works, put the people, their health, and the resilience and the leadership on the head of climate action. So thank you very much, and all in this together.
Please welcome back to the stage FP's Andrew Solinger.
Thank you so much, Holly, for those wonderful remarks and for convening us all together, and Sandrine as well. We're really grateful to AEF and Foundation S for helping bring together this important discussion. I enjoyed the conversation with the ambassador and really liked the panel discussion we had. We had the South African health minister slated to come, and we're hoping we could fit that in later in the program. Unfortunately, very important meetings intervened. I want to thank all of you for joining us and all of our speakers for joining us today, and those of you online that tuned in as well. Really appreciate it. I want to also add that we are going to be doing more programming in this room in an hour, a full day of health programming. It is, however, completely booked and full. So we're going to have to fully exit the room, and we're going to check back in if you're registered for that programming at our registration desk out front, because we're so jammed up and people are asking if they can come back in. It's a very tight attendance and room, as you know. So please do check that program. And if you're interested, look at foreignpolicy.com/events. We do a lot of health programming all year long and more programming here tomorrow. We would love to have you back. So thanks so much. Well done, Holly.